go. Okay. Good evening, fellow Islanders. Another update here tonight. Tonight I'll have with me Minister Aylward will be here by phone, and Minister Hudson, who will both give updates on new initiatives on their part. Just want to update everyone on some of the things that are going on operational here from the Operations Committee first. We continue to depopulate the government complexes, and so far the Charlottetown complex, the one that we're in here tonight, is down by over 70% of the employees are now working from home, which was an impressive effort on behalf of the public service here in a very short period of time. IWMC will be moving to essential services while they'll continue their curbside pickup of waste and compost and recyclables. The disposal facilities will only be available for immediate business needs for drop-off. That they won't be open to the public during this period. That includes the Saturday blue bin drop-off. So that's a new update. And also, government will be coordinating the purchase of any supplies that are needed for essential services in the province, municipalities, first responders, NGOs that are providing essential services. These supplies will include cleaning supplies, hand sanitizers, disinfecting wipes, and we will be starting with a 1-month supply, and we'll add to that as needed. So that's kind of the brief update from the Operations Committee, and I'll turn it over to Minister Hudson for his news.
Thank you, Minister Myers. This is a difficult time for Islanders, a time of uncertainty, and a time where it is in our nature as Islanders to want to help one another. As Dr. Morrison has said, at this critical time, the best way we can come together is by staying apart. It is great to see that Islanders are finding ways to help each other, stay connected, and build community spirit. We are seeing free online art and exercise sessions, virtual trivia, early childhood educators who are reading to their children online, neighbors and local businesses offering support. And I want to thank you to everyone who is pitching in. All Islanders and governments are facing this difficult situation as best they can, but some Islanders face greater barriers than others. I'm pleased to announce here this afternoon that the province of Prince Edward Island is donating $10,000 to the Community Foundation of Prince Edward Island to establish a fund to provide tablets for island seniors, which will allow them to stay connected to friends and family during this isolation period. I should note that the Community Foundation is also accepting donations from the public on this important initiative. If you would like to participate, go to cfpei.ca and scroll to Tablets for Seniors. Our immediate priority is to have tablets for long-term care and community care facilities. We recognize that personal connection and emotional support is essential as we go through these difficult times. We must ensure that our loved ones in these facilities have the ability to connect with family, with community, and with their loved ones. I want to also recognize and thank our NGOs who are providing essential services to Islanders with disabilities. While our government offices have closed to minimize contact, our services will continue. Those on social assistance and accessibility supports will see no disruption in their monthly supports. Child protection staff are still working to ensure the safety and well-being of island children. Housing assistance and emergency shelter support is still available. A dedicated toll-free number is being established to address the social concerns of Islanders, and that number will be available shortly. And I would like to add that this number will help government and our partners in determining any gaps that do need to be filled. Together, we will get through this. Together, we are stronger. Thank you, and I'll turn it back to you, Minister Myers.
Thank you, Minister Hudson. So before we move to Minister Aylward, I just want to also bring along that the Premier isn't with us this evening. He is on the phone currently with the Prime Minister and other First Ministers across the country. So that's why he's not here tonight. So Minister Aylward, if you're ready to go, we'll turn it over to you.
Thanks very much, Mr. Myers. I guess the first thing I'd like to do is to thank Dr. Morrison for her outstanding leadership during this public health emergency. I'm sure all Islanders will agree that she's been handling the evolving situation with expertise and a calm voice. And PEI, we are so incredibly lucky to have her. I myself have been in self-isolation listening to Dr. Morrison's expert advice due to a recent travel, but I'm feeling very well and have been busy working from home virtually with government officials, the Chief Public Health Office, and Health PEI. I want to recognize the outstanding work of healthcare staff all across PEI. Your compassion, dedication is admirable as you continue to care for Island patients. In uncertain times, you go to work each day putting your patients' needs above all else. On behalf of all Islanders, I cannot thank you enough. We all need to remember, healthcare workers are at work for us, and we need to stay home for them. We've been receiving many inquiries from retired healthcare workers offering to return to work to help, which is simply amazing. I want to thank each and every person who has reached out. We certainly want and need your help. If you are a retired healthcare worker and would like to return to work to help during the COVID-19 situation, please reach out to Health PEI at 902-368-4927. Self-isolation and social distancing needs to happen so we can reduce the spread of COVID-19 in our province. I know it can be trying and difficult, which is why it is so important we stay healthy and active at home. So because of this, I've been working with GoPEI to launch Live at Home. GoPEI is partnered with a number of community fitness leaders to provide live home workouts for free. Workouts offered are cardio, strength training, yoga, low impact for older adults, or those just getting started. There are 10 live sessions per week planned between now and April the 12th, either at 10 a.m. or 7 p.m. each day. Videos will be saved so you can do the workouts whenever you want. You can access the workouts and view the weekly schedule by visiting GoPEI Facebook page. First session this morning at 10 a.m. had 145 households turned in. We are so glad to see Islanders tune in and access the support. We hope to see the number of participants increase. I want to thank all Islanders for their continued support and cooperation in following the directions laid out by Dr. Heather Morrison. She said it best when she said, the best way for us to come together is to stay apart. Please remember that although you may be a healthy person, feels you would likely experience mild symptoms and recover, that may not be the case if you were to spread it to someone who is elderly or vulnerable. It's not about you, it's about us. Thank you all, and please stay safe.
All right, thank you, Minister Aylward. We'll move right to the phone lines for questions. I'm sure there's media on, and I'm sure there's questions.
Okay, hey, this is Stu Neatby from The Guardian. I actually had it's more of an economic question. I'm not sure if this will be able to be answered, but I'm wondering about timelines for dispersal of the emergency working capital loans, the $500 a week fund for self-employed individuals. When should people who've applied for those programs expect to get a check? And also wondering when there'll be a rollout for the $200 a week program for people who don't qualify for EI.
Okay, obviously that doesn't fall directly under me, but we'll make sure that you get those answers right away.
Sure.
Anyone else?
Sean McDougall from the Eastern Graphic. I just wanted to confirm, Minister Myers, you said the Premier was on the phone with the Prime Minister tonight. Is he speaking to him in regards to CBC is suspending its local television coverage?
So I'm not aware of what he's speaking about, but I know that all premiers are online. Okay.
And another question: is there So we know there's support for shelters in Charlottetown, such as Bedford McDonald House, and there's also additional financial assistance for food banks. Is there anything else that's being done for rural islanders that are at risk or homeless, such as temporary shelters?
Thank you for that question. And when I had spoke here a short time ago, it was one of the things I noted that all of the programs, whether it's our social assistance, a short income component of the accessibility supports, all of them are ongoing. The very same is with regard to those who may be experiencing homelessness. We still do have the 1-800 number for individuals that do require shelter. That is available. In the event that it is somebody from the more rural areas of the province, we'll certainly, as we have before, we'll continue to make sure that they have a roof over their head.
It's Wayne Thibodeau here from CBC. Can I have, is the Health Minister still on the call?
I am, Wayne.
Minister Alward, I want to follow up a bit about your discussion about the retired workers. I understand I was speaking to some of your officials today. I think there's about 26 healthcare retirees have announced that they are willing to come back to work. I'm just trying to get a sense if you have a ballpark of how many you're hoping to get. Are we there? Do we still need many more? Where are we in that process? And how quickly can they be licensed and sort of in on the ground helping?
Sure. Great question, Wayne. Essentially, at this point in time, we're not going to turn anybody away. The more hands we have on deck, the better it is. We have had immense cooperation, and I'm very, very appreciative and thankful for the College of Nursing, as well as the College of Physicians and Surgeons, and the Medical Society, PEI. That have been working very, very closely with us to ensure that any renewal of licenses is expedited and that we can get these people back onto the front lines as quickly as possible.
And you don't happen to have a breakdown on the 26, how many of those are physicians versus nurses versus other healthcare officials?
Unfortunately, Wayne, I don't have that in front of me right now, but I'd be more than happy to get that for you.
Thank you very much.
It's Carrie Wynne McLeod from Ocean 100 and Hot 105.5. I'm just wondering about the self-assessment tool that Dr. Morrison had referred to earlier today. She thought it would be complete and maybe posted this afternoon. I'm wondering if that link is established yet.
I don't currently have that information, but she'll be available again tomorrow to answer questions on that.
Wayne Thibodeau here at CBC. Just one other question, and I don't know if it falls under anyone here, but I know Cabinet was discussing and Dr. Morrison suggested that we would learn more about how Islanders may be able to access alcohol. Are we any closer to making that announcement yet? When are we going to hear some of those details?
We're definitely closer, for sure. I know there's numerous discussions had on it, and I would expect you'll know more on that tomorrow. We just want to make sure that we do it in a way that all of our partners are aware of what's going on before we get too far out in front of it.
Okay, thank you.
Okay. Any more questions? All right, well, thank you everybody for tuning in tonight, and stay safe.
Sorry.